Welcome to our show, Health and Wellness, Myths and Facts. Hormones affect everything from blood sugar to blood pressure, growth, fertility, sex drive, metabolism and even sleep. Their influence goes as far as changing the way we think and act day to day. There's no doubt that hormones are powerful. One such hormone is insulin. Insulin is a key factor in the development of diabetes. Insulin is a hormone that produced by the pancreas that has a number of important functions in the human body, particularly in the control of blood glucose levels and preventing hyperglycemia. Insulin also has an effect on several other areas of the body, including the synthesis of lipids and regulation of enzymatic activity. There is no doubt that many of you are aware of diabetes, but few are aware of the role that insulin plays in the management and prevention of diabetes. Globally, about 9 million people with type 1 diabetes rely on insulin for survival, and about 63 million individuals with type 2 diabetes require insulin for treatment. Although the discovery of insulin in 1921 revolutionized the treatment of diabetes, inadequate access to insulin and diabetes care remains a problem in many countries a century later. Insulin usage and its role in diabetes management are surrounded by various myths. There are eminent endocrinologists with us today who can help you better understand how insulin plays a role in diabetes management. Let me introduce our guests now. Dr. Manjunath G. Anakal, Consultant Endocrinologist, Virat Diabetes Hospital, Endocrinology Center of Excellence in Diabetes, Thyroid, Hormone Care, Gulbarga, Karnataka. Dr. Ritesh Agarwal, Endocrinologist, AMRI Hospital, Bhubaneswar in Odisha, and Dr. Sandeep Donagon, Consultant Endocrinologist and Diabetologist, Dr. Sandeep's Super Speciality Center in Hubli. Dr. Anakal, coming first to you, insulin and diabetes are intimately connected. What is insulin and how does it work, sir? What role does it play in maintaining the sugar levels in the body?
Fine. Insulin is actually a hormone which is present in all mammals and all humans. It is secreted from the beta cells as a tool. After each meal, the food is digested and is converted into a simple. Pardon?
Anakal, we can hear you, sir.
Oh, fine. Yeah, after each meal, the food is digested, it is converted to simple sugars, what we call carbohydrates, and in a simple language we call glucose, which is the form of the energy which the body needs. It is through glucose. So for this, once this glucose enters to the bloodstream, the pancreas responds by releasing the desired amount of insulin into the bloodstream by the pancreas. And this insulin in turn facilitates making this glucose to enter into the body cells for the energy needs of the body. So it not only facilitates the required energy requirements of the body cells, it also reduces the blood glucose level in this way. So there are two things in this. One is it provides the energy to the cells, and second is it also reduces the blood sugars in the blood. So this way it helps in regulating and maintaining the blood sugars in a very optimum manner. It controls. So in diabetes patients, what happens is this is the same insulin. If there is deficiency or complete deficiency, then the different types of diabetes, what we call type 1, type 2 happens. And we need to understand that whenever insulin is offered to the patients with diabetes, it's one of the best way of treatment because this is the same insulin which is offered. The problem with the insulin is the delivery, because it is the injectable form. Patient thinks that they have a very negative thinking towards this insulin because the pain, they take it in a very negative way, thinking that it's the last stage, it is the final stage, but it's not like that, because this is the life, because this is the one which delivers to the energy needs of the body.
Okay. So how does the functioning of insulin differ in people with type 1 and type 2 diabetes? Dr. Agarwal?
Yeah, so already Dr. Manjunath has said about the insulin and how it acts. But yes, in type 1 and in type 2 diabetes, if you see, In type 1 diabetes, it occurs mostly in younger age group where there is a defect in the beta cell and there is no insulin in the body. But in type 2 diabetes, if you see, insulin is there but it is not able to work. As Dr. Manjunathan said, in type 2 diabetes, we have insulin but it is unable to act at the cellular level to enter the glucose or it allows the glucose inside the cell to get the energy. So it is type 2 diabetes. So in type 1 diabetes, from the very beginning, we will need insulin as a form of treatment for glucose control. In type 2 diabetes, if we will provide some form of insulin resistance or the insulin sensitizer molecule, the patient responds well in the initial stage of 10 to 15 years. Then we need insulin in type 2 diabetes, which occur mostly in obese and elderly age group. So in this way, the type 1 and type 2 diabetes are different, where in one case the insulin is not there and in another case insulin is there, but it is unable to work because of the insulin resistance at the cellular or at the peripheral level.
Now, the prevalence of gestational diabetes is increasing day by day. Is insulin therapy safe for managing gestational diabetes, Dr. Sandeep?
Yeah, a very important question. First of all, we should know what is gestational diabetes. Diabetes which occurs for the first time in pregnancy is called as gestational diabetes. Specifically, it occurs in the second or the third trimester. The prevalence of gestational diabetes, as mentioned by you, is increasing day by day, especially in Indian population. Currently, the prevalence ranges anywhere from 7% to 16%. Or to put it in a simple words, approximately 4 million women have gestational diabetes at any time in India. It is important to keep the blood glucose levels in normal range during pregnancy because it not only affects the health of the mother but also plays a vital role in the normal growth of the baby. The blood sugar targets are designed in pregnancy to minimize the risk of birth defects or miscarriage, also help prevent the baby from getting too large, among other adverse effects. So for the treatment part, most of the pills which we generally use to treat diabetes, it is not known whether they are safe or not for use in pregnancy. So the choice is narrowed down to only a couple of options. Among them, insulin is the safest option because it is a natural hormone. It does not cross the placenta and affect the baby. It is very effective in controlling blood sugars and also it helps in fine tuning the blood glucose levels, which is very important in pregnancy. It has been in use for a very long time in clinical practice without any notable long-term adverse effects. So the bottom line is insulin is not only safe but also vital medicine for controlling blood glucose level in women with gestational diabetes.
What does it mean when a person has high insulin levels? Is it bad, and what can cause it? Dr. Manjunath?
Hi. This high insulin is one of the indications that primarily it's the first indication that the metabolic problem has started in the body. Because whenever the body tries to maintain the blood sugar levels in optimum range, which is through insulin, and the body is not able to respond to the normal level of insulin, then it's the adaptive mechanism of the beta cell which tries to increase the insulin levels so that it brings the blood sugar levels in the normal range. So that adaptive mechanism causes increase in the insulin levels. But it may, for that point of time, the blood sugars may be normal, but the high insulin levels remaining high for a longer duration has its own effect. So this insensitivity, what we call as insulin resistance. Insulin resistance causes high level of insulin in the body, and insulin being high for longer duration itself has its own ill effects on the body, because insulin through various molecular mechanisms, the insulin directly causes rise in hypertension. It causes dyslipidemia, what we call like increase in the bad cholesterol, decrease in the good cholesterol, and it also causes endothelial dysfunction, which leads to the blocking of the arteries like coronary artery diseases, and increasing the PCOS, and even it causes hyperandrogenemia in girls, causing hirsutism, excess of hair. So there is a big spectrum of problem which causes metabolic problem, what we call as metabolic syndrome, with increase in insulin levels. So now what is the cause for this insulin resistance or a rise in insulin levels? The cause is insulin resistance primarily because of present day pandemic, because of obesity, increasing obesity and sedentary lifestyle are primary things. Along with that associated genetic causes. Of course, it's primarily genetics, but the present day pandemic of obesity and sedentary lifestyle has really made things worse. So the simple one solution for all the spectrum of problems associated with the high insulin levels is maintaining an optimum weight and optimum BMI and having a good lifestyle and a good balanced diet. Probably we can address all these problems. So a high insulin levels indicates that there is an started the metabolic problem. It is the diabetes only a tip of the iceberg. The actual problem is the metabolic problem, which is seen through the eyes of the insulin.
All right, so what is the recommended ratio of long-acting insulin to short-acting insulin to meet all insulin needs for the whole day? Dr. Ritesh Agarwal?
Yeah, so now the long and short-acting insulin ratio, we have a different guidelines to find out the ratio to decide the total daily dose of insulin required for the treatment of diabetes. So we can use very different type of ratio like the 1500 ratio, where we can decide the total daily dose of insulin. Let's see in terms of the person taking 10 units of insulin 3 times a day. So the total daily dose is 30 units of insulin. So 1500 by 30, if you give it around 50. So 1 unit of insulin is going to decrease 50 milligram of the carbohydrate. So this is the way we can find out. Another school of thought is also there in the calculation of this meal plan, where 1 unit of insulin, how much blood glucose level will reduce, like 450 divided by the total daily dose again. If our blood glucose is more than 50 milligram per deciliter from the target, like if you see the blood sugar, if you want to maintain at 150 milligram, but it is 200 milligram, so it is 50 milligram higher. So if you will divide 450 by 50, so it will require around 1 to 2 units of insulin to reduce this 50 milligram of blood glucose level. So the ratio of the 1500 or 450 with the total daily dose is helped in calculating the amount of insulin a person required to reduce the blood glucose level to achieve the target blood glucose level. But yet, it has to be individualized, and we have to keep in mind the risk of hypoglycemia, which is also a complication of this insulin therapy. So this is the simplistic way to find out the dose of insulin, but we have to keep in mind this insulin treatment has some side effects, and we have to individualize our treatment by seeing the patient condition.
Dr. Sandeep, coming to you now, what precautions should be taken while storing insulin? How long can insulin be stored in a syringe?
Yeah, this is important information for people with diabetes who are on insulin and also their family members, because wrong storage technique might affect the viability of insulin, and it can be an unexplained cause of high blood glucose levels who are taking insulin regularly and judiciously. There are some general guidelines which have to be followed when using insulin. Insulin should be stored in a cool, dark place, temperature being less than 25 to 30 degrees. It must be protected from extremes of temperature in places like that have direct sunlight, kitchens, closed cars, or top of your refrigerator or your TV. So this becomes specifically important during the summers in India when the temperatures are going high. So if a refrigerator is not available, when what can be done is put the vial or insulin vial in a plastic bag, tie it in a rubber band, tie it with a rubber band, and keep it in a bottle of earthen pitcher filled with water, which is available everywhere. And never keep the insulin in the freezer compartment of the refrigerator. It has to be kept in the normal cooling area to maintain a 2 to 8 degrees centigrade, that thing. And if you're traveling and the outside temperature is more than 30 degrees, insulin can be carried in a flask with ice or in a proper insulin carry pack. For those who are traveling by air, insulin should be put in cabin bags which you carry with yourself, and not in check-in baggage. And make sure that the shelf life is adequate enough for the duration of your trip. So these are the things we have to remember with regards to insulin storage. Insulin should not be kept in syringes, stored in syringes, as it is single-use syringes. So, yeah.
All right. With that, we'll take a very quick break, but we'll be back with a lot more on this subject. Stay with us. Welcome back, and going back to our discussion immediately. Dr. Manjunath, where is the best place to inject insulin? What is the minimum interval between insulin injections?
Fine, this is a very important question because delivery of the drug is very important. Unless the right technique is used for delivering the insulin, the right effect is not really, we don't get that effect. So the whole idea of injecting insulin, it should be given, it should enter the subcutaneous fat, what we tell. So now what are the places, where are the places where have a good subcutaneous fat? It is the good subcutaneous fat, where it is beside the belly button, around 2 to 3 centimeters from the belly button, around the tummy we can take it. And it can be taken on the behind the arms or the lateral or posterior aspect of the upper arm, or it can be taken on the anterolateral aspect upper thigh, and also it can be taken in the back. So basically the idea is the subcutaneous fat, the insulin has to enter into this subcutaneous fat, because the pharmacokinetics should match with the desired result only when if it enters the subcutaneous fat. If it by chance enters into the muscle, the absorption is going to be very quick, and it can cause low sugars because the action is going to be quick. So that's why the desired results and the desired absorption, desired level of insulin is achieved only if it goes into the subcutaneous fat. So these are the areas. The another important aspect of this is we need to understand that whenever we prick, because especially type 1 diabetic patients, they need to prick around 3 to 4 times every day. So it's very important that if they keep on pricking, usually it is tendency of the patients that they keep on pricking on the same side, because there is certain amount of comfort by pricking on the same side. Say they keep on pricking, around 30 to 40% of the patient keep on pricking on the same side, which causes called as lipodystrophy. There is proliferation of the fat cells, and they keep on pricking in the same place. The problem with this is it causes this abnormal absorption of the insulin because of the development of lipodystrophy, and also cosmetically also it looks very odd because there is some swelling kind of thing is seen. So it's very important that it needs to be injected at the different places each time, what we call as site rotation. So every time the insulin is taken, it has to be changed from one place to another. At least 1 to 2 centimeter of space is changed each time it is taken, and the area has to be changed from one side to the other child. At least weekly it should be changed, so that there is the site with site rotation, there is no development of lipodystrophy, which is very important and which helps in smooth absorption of the insulin.
So, Dr. Ritesh Agarwal, is it possible to reverse diabetes if you start insulin therapy right after the diagnosis?
Yeah, so we can use this word diabetes reversal, which is possible in type 2 diabetes and also in some cases of type 1 diabetes, as we have discussed, where we can say it is a honeymoon period, where around 6 months to 1 year or 2 years, some of the patients don't require any of the medication. So if we say about the type 1 diabetes, here it is known as the hormone period in the management, or the honeymoon period in the management of diabetes, where the type 1 diabetes patients are off medication. In type 2 diabetes, as Dr. Manjunath has earlier also said about the role of metabolic syndrome, if type 2 diabetes patients who are especially obese, newly diagnosed with high sugar, we give insulin for around 3 weeks to 1 month, and if they will reduce the body weight of around 10 to 15 kg and they will achieve a good lifestyle, then it has been shown in the different studies that the patients are on without medication for 2 to 3 years. So we can define this as diabetes remission, diabetes reversal. Some of the patients are on partial diabetes remission, where they require the medicines or insulin after within a year of stoppage of medication. So it can be possible with lifestyle modification, weight loss from the beginning if we will follow the instruction of our dietitian, of our physician, and to maintain a good body weight. So it is possible.
All right. All right. But is long-term insulin use safe? What must be kept in mind while on insulin therapy, Dr. Sandeep?
Yeah. Insulin is generally safe even when used for long periods of time. People get confused by the complications of diabetes, for example, on the kidneys, heart, etc. In fact, these complications are caused by keeping the blood glucose levels high for a long periods of time and not caused by the treatments which are used to treat diabetes, be it insulin or other medications like tablets which we use to treat diabetes. Having said that, we have to keep in mind some things which can be associated with insulin usage. As mentioned by Dr. Manjunath earlier, first thing was weight gain. It can be as a result of your blood glucose levels returning back to normal after treatment. It can happen with tablets also. The solution is better control, diet control and exercise. The second more important aspect is hypoglycemia or low blood glucose levels. So we call blood glucose level below 70 milligram per deciliter as hypoglycemia. This is when we have to take some action to bring the glucose level back to normal range. Now, when can hypoglycemia or low blood glucose level occur? When somebody is taking less amount of food than their usual habit, but the same amount of insulin, causing the insulin glucose mismatch. When somebody is exercising or exerting more than usual and taking the same amount of insulin, or when somebody is sick. Usually when we are sick, we have to follow something called as a sick day guidelines or sick day rules. That is, we have to continue the medications as prescribed, check the blood sugar level frequently every 4 to 6 hours or more frequently if required, maintain some form of calorie intake, drink enough fluids to avoid dehydration. When we have hypoglycemia, we have to consume glucose in some form like glucose tablets, some juice like orange juice, or even a small snack. So these are the important things to be kept in mind to avoid low sugars or low glucose levels with usage of insulin.
All right. With that, I'll have to thank all our three doctors for joining us here on the show. Taking a very quick break now. News and updates will continue.